Hey, so answering another question of yours, we've talked about clients, we've talked about staying up to date with the literature, and now we're going to talk about clinical skills. So here's the question. How can I master clinical skills at this point in my career that I feel like I should be able to do, but have rarely or even never done? Examples: PU or perineal urethrostomy, penile amputation on steers, ruminostomy, or ruminotomy. I'm completely mobile. I'm a completely mobile vet, and we would normally refer these types of things, but I've now started working in a clinic and would be embarrassed as the quote unquote cow vet that I didn't have the confidence to perform procedures like these. So first of all, there's no reason to be embarrassed. There are lots of people who have not had the opportunity to perform these kinds of procedures. It depends so much on your geographic location as to how much these are indicated, especially for things like the urinary tract surgeries. It depends on your clientele. It depends on the culture of your practice. Do you tend to refer or do you tend to keep those kinds of things? So there's no reason to be embarrassed. So what are my tips about this? Number one, get your hands on videos. There's a reason that when I developed largeanimalce.com, having lots of pictures and lots of videos to demonstrate procedures was one of my number one priorities. I knew that you guys would want to see these procedures being done live. And so that was a big priority to me. So you can access videos for a lot of these procedures that are listed here, there, and there are other resources available that also have photos, videos, descriptions available. And so do your background, read up, look at some videos, look at some picture series, those kinds of things, and get ready. The second thing is, and this takes some finesse and some client relationships, which is if you have a client who has an animal die, let's say, for example, you resolve a dystocia and the calf is deceased. Maybe that's a good time to ask that client, hey, while I'm here, since the calf is deceased, I'd like to kind of make something good come out of this. And I've really been wanting to practice a CSF tap, for example, or I've really been wanting to try a ruminotomy. Maybe there's an older calf that dies that has a developed rumen, and you say, hey, would you mind while I'm here if I just practice this surgery for a few minutes before you dispose of the animal? And you might be surprised when you have a good working relationship with a client how willing they are to let you use their animal to learn from and to practice on. And so that's something to consider as well. And then finally, just go for it. We all do, even I do surgeries that I haven't had a ton of experience in. And so don't think just because you don't have a lot of experience with it means that you can't do it. And so again, it comes back to doing your homework, watching videos, doing those kinds of things, and being ready. But sometimes you just need to jump right on in there. And the bottom line is you were trained with surgical skills or other procedural skills that you can adapt. And as long as you understand the process of the surgery and the anatomy and what's supposed to happen, you can do these procedures. And so don't hold some of these procedures to be so lofty that if I haven't done 10 of them, I'm not going to be any good at them. That needs to go away. You do need to be prepared, but you don't have to have done a bunch of them in order to be able to perform the procedure in a way that can be very useful. So again, I've been mentioning my one-on-one mentorship program. What I haven't really been telling you guys yet is that I'm about to launch that truly officially a week from today. And I'm only going to have 3 spots available for folks who want to be in that one-on-one mentorship program. And what that means is I am going to basically walk alongside you in practice for the next 3 months. So you will have Voxer access to me, which is voice text as well as text. So you can be literally driving down the road and just talking to me on this app, and then I can respond to you. And then you'll also receive 10 hours of continuing education off of the LACE site. So I think this will be really valuable for a lot of you who feel like you need to kind of accelerate what you know about clinical skills, maybe how to develop a stronger relationship with clients and really become their trusted mentor, and also to help you keep up with the latest research, new findings, and how to translate that to your clients. So I'll be available to you for all of those issues. So take a look at drmeredithjones.com, read the details of the program, and remember, I'm only going to open up 3 spots for this because I really want it to be a high quality experience for those that are enrolled. And so go ahead and get on the list and we can chat about whether it'll be a good fit. Take care.